And let us start our practice test. The question number 1. Miss Z, a 45-year-old, has a simple goiter. She is being seen by the community health nurse for teaching and follow-up regarding nutritional deficiencies related to her goiter. Miss Z's problems are most likely associated with which of the nutritional deficiency? Options are iron, option B calcium, option C iodine, and option D sodium. So here the patient is 45-year-old and complains of simple goiter. So the correct option is option C. Lack of iodine in the diet is a primary contributor for the development of simple goiter. So option C is the correct one. Option A diet deficient in iron is likely to be related to iron deficiency anemia. Whereas option B, a calcium deficiency is likely be related to osteoporosis. And option D, a sodium deficiency would likely be repeated or related to abnormal large output of urine as seen in diabetes or untreated diabetes insipidus or diabetes mellitus. So these A, B, D options are incorrect. The correct one is option C. Let us go on to the second question. Mr. Noah is admitted to medical unit with suspected Graves' disease. Which assessment finding by the nurse requires primary intervention? So the question is here, the client admitted with suspected Graves' disease, and which assessment requires priority intervention by the nurse? Options are option A heat intolerance, option B red and bulging eyes, option C pulse of 110 per minute irregular in rhythm, and option D agitation and confusion. So out of these 4 options, which one is correct? The correct option is option D. Always thyroid storm is a life-threatening complication of this Graves' disease. How it is characterized? There will be fever, altered mentation, excessive autonomic activity like severe hypertension or severe tachycardia are common. Early recognition and treatment is very important. So option D is the one important. Option A heat intolerance, that is an expected symptom of hyperthyroidism including Graves' disease. Option B exophthalmos or protruding eyeball, that is common in Graves' disease. The eyelids do not close over the eyeballs properly, leading to excessive dryness and resultant corneal damage. And option C, tachycardia and arrhythmias are very common in hyperthyroidism of any cause including Graves' disease. So correct option is option D.